Hello and welcome everyone to today's GLI Live. My name is Donna Cryer. I'm the founder and CEO of the Global Liver Institute, and I have the privilege of being your host for yet another episode and a fascinating discussion. So for those of you who participated in our International NASH Day, and I hope that was everyone around the world, then my next guest will be no strangers to you, or at least the name. So our topic for today is liver healthy eating. There's an app for that, and the app in question is GLI Partners NutriStyle. With us today, their CEO and co-founder Todd Albro is the co-founder and CEO, and then I also have Scott Murdoch, who is Dr. Murdoch, not only a PhD but a registered dietitian, which I know is such a difficult degree to get. I think it's even harder than an MD, and we'll go into that. The co-founder and chief nutritional officer of NutriStyle, and as many people say, bodies are built in the kitchen, and let food be medicine is an even older quote. And so I am so excited about our discussion today about how we are partnering to help everyone live a liver healthy lifestyle. So welcome, gentlemen.
Thank you very much.
Thank you very, very much. We're thrilled to be here, and we're thrilled to be working with Global Liver Institute. So you guys do great work, and we're happy to be part of it.
Excellent. And so, let's just start talking about the need you saw that we all see that compelled you to create this app, this platform, this resource for people.
Sure. A little bit about the history of NutriStyle. My background is craft foods. My early career, I was on key accounts and part of the launch team of Lunchables and Jello pudding. And my real claim to fame is I've driven the Wienermobile, which is my kids think is the most exciting thing about me. But Scott is mentioned as a PhD and former professor, taught at Cornell and taught at Stephen F. Austin, and most recently at Bastyr. But one of the things that Scott would do is he would take his students who'd go on to become registered dietitians, physicians, naturopaths, and nurse practitioners, and he would teach them how to create menus. So as he taught them how to create menus, he'd go down into a clinic in downtown Seattle, work with the patients would come in, what are the maladies, what are the food likes and food dislikes, and then he'd teach them how to put the foods together and say, here are your nutrient targets, food you should have and shouldn't have. Well, then those students went on into the clinical world and quickly realized that they don't have time to create menus for the patients. So they called Scott and said, hey, Dr. Murdoch, is there an app online that will do what we need to do that is clinical quality? And the answer was no. And being naive, I said, well, that can't be that hard. And 3 years later, we did it for the first time. And it really is the uniqueness about this is that it thinks like a dietitian. The algorithm acts, and you're able to take what whether you're addressing malady like diabetes or obesity, which are very related to liver disease, you're able to put together the nutrient targets, and we don't have any pre-existing conditions, which means we can then tie into whatever food database that the user wants to tie into, whether that's at Amazon, Wegmans, Albertsons, Kroger, and we can create meals based on their personal preferences and their brands that they like, as well as their own personal recipes.
So that is fantastic. So I think it's famous last words always. I've been known to fall into that trap too. How hard can that be?
Yeah, how hard can that be?
Well,
exactly.
Could have already done it, is what I've learned over years. So I'm just going to venture, though, that Scott, as you brought your students in and as you talked with Todd, that the menus that you came up with did not exist. That did not consist of hot dogs and Jello pudding.
Oh, no.
And so, what goes into a liver healthy diet, and what when people sign into the NutriStyle app, the global liver page about it, what types of things will they see? What types of what are the elements and components that went into thinking about how we put together liver healthy menus and recipes?
Yeah, well, that's a really good question, and I think uh, it's helpful. I'm going to tell you what my perspective is on this when
Mhm.
Todd and I got together and what was going on at the time. We know that there's a great deal of excellent evidence and research going on with what I would call the nutrient characteristics of the foods and breaking them down somewhat in this kind of reductionist fashion, but it's led to really terrific understanding of food and disease and that kind of stuff. But what most people, I think, are aware of is that there's another side that has to do with the actual other characteristics that foods have, and very often they're traditional. And look at that. So at the time when Todd and I were together, it was really it was driven home to me that we need to make sure that this application is what I like to refer to as a food-based app,
Mhm.
meaning it's not just about hitting those nutrient targets, which are very important for sure. It's actually about there's a whole other bunch of characteristics, from acid alkali to expansive
Mhm.
contractive to hot and cold to other nutrients that aren't essential but actually will help build probiotic activity and microbiome. And all of that actually gets to the food part of it, not just the individual nutrient part of it. So when this, Todd being in food and me
Mhm.
being in nutrition science, that bridge between the two was critical at the time. And that leads to your question, which is, what does this app do?
Mhm.
Excuse me. This app builds the menus from scratch with foods and ingredients and recipes in real time based on those characteristics that the user has. So when you look at that crowded space of all the other nutrient apps, this one actually kind of brings them all together, I would say, in a way that the end user can have exactly what they need, make it food based, and then hit the targets and have the corresponding shopping list. So that's a kind of a high level perspective from
No, but
my
you said important things, and I think that for you explaining the complexity and everything that really could and should go in to
Mhm.
about how you construct an eating plan. I won't even call it a diet, an eating plan.
Yeah, yeah, no,
Um,
that's right.
uh, that's overwhelming for a lot of
Yeah,
people who are not registered dietitians,
yeah,
and particularly if you're balancing, you know, learning about your disease or your health condition, trying to go to the doctor's office and do those things, taking your
mhm,
medication, and then, you face your kitchen, which, maybe previously had been your safe place or at least a happy place. And now
right.
is, oh my gosh, I don't even know what to eat here to go in here. Everything can hurt me, or,
Yeah,
I don't know what to do. And so to have all of that sort of thinking done
yeah,
um, is marvelous. And I think when we talk about reducing the patient burden at the Global Liver Institute, this is a really essential part of helping patients, reduce the burden of this part of taking care of themselves. Because, as most people know, I'm 26 years post liver transplant, and I also have inflammatory bowel disease. And so, you know, um, what I eat and how I move and exercise is a huge component of, I believe, of allowing all of the surgeries and medications and some of the Western
mhm,
medicine, part to work the best and to sort of
yeah,
optimize that. And so I think one side, it's not. Some people say, "Oh, I just want to do everything through food." Maybe if you're lucky to
mhm,
do that, that's fantastic. Or I just want to take my medicines and not worry about diet and things like that.
right.
I just don't believe from everything I've seen that you can really work as well as it could. You really need both.
You're
Um,
spot on.
yeah, and
Yeah,
so with what I love with what we're building is, many of our patients with liver disease have um, more than one condition.
right.
They may even have more than one, GI condition. Like I
Mhm,
often getting conflicting results, and so I see patients online who ask us, well, I have diabetes and liver disease. Like, am
mhm,
I? Is this? Am I? What am I supposed to eat? Is that the same? Or, for someone like me, I have, the inflammatory bowel disease leads me to eat low fiber diet. And for the liver health, it might be, different. And sometimes, they're in conflict. And so if you're getting sort of conflicting recommendations from your doctors about what you should eat, one says, all salad, one says no salad. And I'm like, what am I? I'm just going to have the Jell-O pudding. It just, people default to like, it's just too much to do. And, and I'm just exhausted by it. And so, let's walk through in even more detail, what people will experience when they sign on, and they have the opportunity to just, particularly if they have fatty liver disease or NASH, now they can, click the NASH button really, and out comes kind of a NASH friendly or a liver friendly menu. And what are the types of things that people will find on that list that they can then take to the grocery store? Because Todd, you're so right. And being able to, go get real foods as you would for the rest of your family, and as you've been doing all your life, is just really amazing to go to your local.
Well, and Donna, it's also important that you have the specific brand, because when you look at our program, we have the nutrient detail. And if you were, for instance, to take a look at a tomato soup and someone's trying to control their sodium intake, well, there's a big difference between whether that's Progresso, Amy's, Campbell's, or one of their other Campbell's, you have a little sodium. So by having the specific brands, and what we're really trying to do is take the fear out of how do I do this, and how do I walk in, and because as you nailed it, the kitchen used to be a really fun place, but now you walk in the kitchen, and especially if you just found out one of your children has diabetes and you're scared to death and you're trying to figure out, well, what am I going to do? And you've been giving a food inclusion and exclusion list, and you are trying to figure it out and count the sugars or do whatever you can. And that's really what we've seen as we've come into this, is there's a real need out there for the consumer to make the ability for them to be comfortable with what they're buying and what can they eat, what are their current recipes that they can have. And so we are able to include that and be able to put those all together, and I'll let Scott kind of walk through the details of the program. But it really is about being able to be the partner and empower that individual to address those maladies that they're living with.
I would add to that two things that you said, Donna, that were really important. And one of them is kind of, again, from our application standpoint, it's not just in the past. I think the kind of many of these apps don't work because they tend to be either top down, like these are the good foods, now you eat them. Right. Without any input from the user on what their preferences, what the individual requirements would be, and a whole host of things. So that bridging between a tool that the user can actually manipulate in a way that benefits them and fits their lifestyle is key. And it's been missing, and it hasn't been comprehensive enough in the past. And the second thing you said, which again prompted me to remind users, when you were talking about your irritable bowel syndrome and inflammatory bowel disease, and how when you have a flare up, you're supposed to be lower in fiber, and when it's gone, you increase fiber. Those kinds of recommendations are just really good recommendations, and the user has no real way to discern or implement that good recommendation. And so having a tool like ours, I wouldn't say it cuts through all that noise that we all hear. I think what it does is it makes actionable the very recommendations that we're all trying to follow, right? It does it in a way that can make it available to the user without them having to be a mathematical prodigy to figure out, how do I get this sodium in that particular food item and make it work with my total protein needs or something along those lines.
So, and it can be it's as simple as a person getting on the site, and then they register. We get some basic information about their height, weight, age, and activity levels so that we can put together what are the kcal requirements of what they're trying to accomplish. And then they go through and they tell us where, where they shop, what area of the country they live in, because you have the regionality of it. So you have, foods like, being a military brat, having lived in the Southeast and getting black-eyed peas and grits for the first time, I had no idea what they were because I grew up mostly in New England. So, you have to look at the different regionalities of how people eat, and also the seasonality. What are the fruits that are in season, and put that together so that. And that's what we do. We get that information. We know what time of year it is. We know from the zip code where they live. And then they go through and they tell us what, they choose the NASH diet, and then they can do gluten-free, they can do vegetarian and a few other things. And then we create the menu for them. And it's a 7-day menu, and they can at that point then create a shopping list, and that's all they need to do. Or they can get much more in depth. So you have the ability to be very quick and easy, or you can get in depth. And I'll let Scott talk a little bit about the depth of the program.
What I loved was is that learning capability and that personality of it. But I'll have to admit, when I signed on, it really just hit it right on the head, just from the first iteration, from the first menu, and to the point where I was like, that's actually what I'm having for dinner.
Right. Fantastic.
How did it know? And so I was like, oh, this is so spot on. And you can't tell I'm really excited about this, because I was just like, it's so spot on already. And then the thought that it can learn with me and learn my favorite brands and preferences and fit things in culture is just so exciting. So, Scott, delve into how that works even better for people.
Yeah. So one of the things that's important to know, since there are all these kind of dietary approaches out there for everything under the sun, and some of them are reputable, some of them less reputable, some of them mixing and matching, there is no, so first of all, demystifying the kind of menu concept in the first place is every single dietary plan, menu plan that exists really deals with 3 separate categories of variables. It's nutrient targets is one. It's foods or food groups to include, and then food and food groups to exclude. There isn't a clinical diet, isn't a popular diet that doesn't do some manipulation of those 3 categories. And the back end algorithm of our app, since it builds menus from scratch, taking into those characteristics and preferences of the user, literally just helps us manipulate those 3 categories. In other words, you as a 26-year-old female with these conditions have these nutrient targets. You have preferences for foods, not nutrients anymore, that actually make round out your diet and follow the really good recommendations about getting better oils, for example, eating a more plant-based, avoiding some of the refined carbohydrate foods, that kind of stuff. And so that's a food-based side. And then if you, in addition, have any what I would call food restrictions or other things, like you mentioned, comorbidities, like I might have insulin resistance, type 2 diabetes, there's another layer you can layer over that to make it, at the back end, you don't have to do it. That's what we do. Layer over it to make sure that menu has the proper glycemic response for the full day and for each of the meals. So having that ability by being food-based and having the algorithm adhering to those 3 major categories is a relatively simple way of seeing it. And then the devil is in the detail of making it happen. But at least conceptually, you can see how the algorithm approaches this problem of trying to get a menu that works.
In some of my exercise, Facebook groups and things, you just have people sort of screaming at you. You need to count your macros. I'm like, what's a macro? And
right.
And so, it's like, okay, so I happen to know what a macronutrient is versus a micronutrient, but I'm like, it's scaring people who, think they have to, buy a scale and start, counting their, grams.
No.
of
It-
carbohydrates and fats and protein, and to such an excruciating detail. And as we were thinking about what would be a pro liver diet, it was certainly some of those considerations, but really taking the fear out and the workout
Yeah.
for people as they do balance. And so our NASH talking about was, as you mentioned, about shifting to healthier oils, shifting to more proteins, if plant-based, and particularly if you have GI conditions that can tolerate, shifting to more plant-based sources and higher fiber, but just making it really easy to make those adjustments, and translating those adjustments from you're hearing about them, you're talking about them with your doctor or your dietitian.
Mm-hmm.
And what does that mean that you need to put in your cart?
Yeah,
Does that mean in terms of what am I having for dinner tonight, based on, like, I agree, I'm sitting in the doctor's office and I agree, I'm supposed to eat healthier fats and shift to protein, and then I walk out of the office, I'm like, what am I supposed to have for dinner? And so this is so amazing, I think, because it answers those questions. What am I supposed to have?
And what we really try to do is take the guesswork out and the fear out of addressing that. So we put together the macro and micronutrients, and then we display them. So if you want to see exactly all your micronutrients, you can see your micronutrients. And if you want to make a change in the menu and say that you got a breakfast cereal and you'd rather have a different breakfast cereal, you can change that and compare the macro and micronutrients of the two and be updated automatically. So it takes all the math and the guesswork out. And so we're here to empower the user and make their life easier, because it's hard enough dealing with the malady. And so any way that we can help make that easier to live with, well, that's one of the reasons we partnered with you, because of what you're doing and our ability to say, hey, we can help people here. So we're really excited about the opportunity.
Thank you. We've had so many people. I was talking to some folks earlier today who had participated in our culinary event with Chef Daniel Thomas, and they were like, we cooked along, and then we signed up for the app, and we've been using them. And these were nurses at transplant hospitals who were saying, not only were they passing this along to their patients, but they were saying, they were using it personally. And that's
fantastic.
Like the best feedback, and with such, success. And so, our plans going forward, as but I'm saying is for the audience, is to host International NASH Day, to make sure that all 70 members of our NASH Council have a plan to roll out and introduce this app to their communities. If we do, certainly this GLI Live, is part of that. But as we talk with, there's some fantastic nurse practitioners and obesity medicine specialists that we're working with in fatty liver disease clinics across the country. I know the dietitians, closely, who worked with me, pre and post transplant. The nutrition component is so important. And so I'm really excited that, yes, we launched this, but to really get people around the country and around the world to be using this is the exciting part, and to be embedding it into community events, and to have it at the end of all of our GLI lives as an opportunity for people, making sure too that this is rolled out to underserved communities. I think the ability to make culturally appropriate diets is so important, because in a lot of previous sort of health initiatives and diet plans that have been put out, they weren't accommodating make it curried, or if you wanted to if you were living in the South, east of the country, and black eyed peas was a common vegetable. And so this ability to do regionalization and cultural adaptations is so important. So as we talk with the members, particularly of the NASH Council, who, we have the Association of Black Cardiologists and the National Alliance for Hispanic Health, and we're working now in the Southwest with different Native American groups. So that's what I really see as excited about this, about having a tool that is really relevant and useful.
One of the things you touched on is the underserved communities, and that's something we're having a lot of conversations about with how do you do the food deserts, and not just the urban food deserts, but the rural food deserts. So, you got to look at both of those components. So it's something that we are looking at addressing, and the food industry is very aware of, and the need is there. So there are several different organizations that we're early stage conversations with of trying to address that need, because just as somebody in a urban environment may not have a store near them, you might have somebody in a rural environment that only has a very small store with a limited selection. So we're working with both of those different components. So we're also looking at some of the potential Indian reservations and the needs that's on the reservations there, and how do you combine that with the different programs that are there. So it's something that I think long term, we roll this out. We're looking forward to working with you and other partners on how do we address these needs, because it's pretty easy for the typical suburban family to go down to local Kroger or order on Amazon and do there, but there are real challenges for other segments of the population. So while we want to make this as easy for the somebody who's living in suburbia that has different food choices, we also want to deal with, okay, what about the people who are having more challenges, and not just where do they shop, but they're addressing new medical needs and
more narrow.
themselves.
They have more narrow options to choose from.
Yeah.
So,
Absolutely. Where I sit in Washington, D.C. today, I'm equidistant between 3 Whole Foods and 2 Trader Joe's. But I contrast this with my grandmother's house in West Virginia. And I think that was my that was my exercise plan. Go walking to the store, to the grocery store for my grandmother. Down the hill, down the road, down the other hill, to the store. Back up the hill. That was a thing. And so that rural access and choice is I think an important component. And I've advised a host of different companies who are setting up health hubs through various corporations, and I'm sure we're talking ones, who are in many communities and have recognized the need to provide groceries and to provide everything from eye care to testing. And so I think that food as the center of health, this app and those partners can really move public health forward in a very significant way.
Well, one of the things we have coming in the near future is a WIC and SNAP preset, because it does vary from state to state what foods are available.
Right.
So we want to make sure that we're able to create menus using the foods that are available within that state. So that's in our technology roadmap. That's one of the things we're pretty excited about.
I think that's fantastic. We have a lot of patients who, say, I want to adhere to the dietary recommendations of my doctor, but I can't afford the foods on these lists, and or my SNAP benefits or others. And so from a policy standpoint, we've been working with the Medical Nutrition Equity Act, and we've also been in conversations about with the Department of Agriculture on the SNAP and other programs. And so yes, that integration into what your doctor's recommending and what you have available to you, really making adherence possible. So many patients, and particularly people of color or patients from low resource backgrounds, are non-compliant. they don't want to be healthy, they don't want to be well, don't want to work with their doctors. It's just, it becomes infeasible or practically impossible within their environment to access those foods or follow that advice. And so to create an environment where it is easy for people to do the things that they want to do to be healthy, I think just is really I think it's underestimated in trauma and distress and frustration for people that this would result in.
Well,
I think
it's.
I want to say,
Yes,
sorry, you nailed it with the best tagline so far, which is making adherence possible. When it all comes down to it, I'm different, I'm unique, one size doesn't fit all. How do I implement those things?
Mm-hmm.
If you can implement it, you can make actionable those things, to me, then it works.
Well, and it's all about meeting the people where they're at,
Mm-hmm.
So, and if you go in and say you have to do a 180 and change everything, you're not going to have success. But if you get somebody to make a 5-degree change and then a 5-degree change and a 5-degree change, and there's a McDonald's in every corner because that may be where people can afford to go. I mean, as entrepreneurs, we've been through that stage where, you want to take your kids out and you can afford that. So you go there. So if you're going to do that, well, what should you be eating? And, what are some of the healthier choices where you're limited to where you can go and your resources limited. So you're trying to meet the people where they're at, to give them direction to say, instead of having this, have this, and then we can combine that with what you're going to have for the rest of the day. So that's kind of the vision is, we want to be something that people can sit there and go, hey, this really is about me.
Mm-hmm.
That they understand what I'm going through. And that's the goal.
I love it. So it's making adherence possible in the real world.
Yeah, it's a real world.
So I think that's
Well, when we created this, we gave everything the ho-ho test, and said if somebody really wants a ho-ho, you got to give them a ho-ho. Or if they're going to watch a football game on, Sunday and they're going to have a couple of beers and they're going to do that, you got to allow the program to put that in there and say, okay, well, you can have a couple of beers and you're going to um, be able to adhere to your menu and put that together, because we will include that. And you talk about macronutrients. Well, alcohol is a fourth macronutrient. So it's a nutrient, and you got to be able to adhere to that. Or somebody who wants a glass of wine with their grandmother's spaghetti recipe on Friday night. So again, meeting people where they're at.
I would just point out that since people are at different places, some of that flexibility doesn't work, but definitely metaphorically speaking, that's exactly right.
Yeah.
Yeah. Helping people, adjust to get to that place is much more likely if they have this guidance, and maybe it won't seem as extreme or hard to get to. With the NutriStyle app and the support of Global Liver Institute. So I thank you for this conversation today, and I'm so excited about all that we can do moving forward. And so everyone can see our NutriStyle.com/global-liver.institute is where you can sign on to try this out yourself. So until next time. Stay well, stay connected. You can find all of our episodes on Facebook, on Twitter at Global Liver, and on Instagram at Global Liver Institute. Thank you.
Thank you, Donna. Appreciate it.